Hi, I'm Dr. Eric Mazer. We have an Ask the Doctor question. Our doctor is Dr. Teresa Menendez. She is a cardiologist and electrophysiologist with Nuvance Health. And a question for you, Teresa, is what is electrophysiology and how is it useful? I don't think a lot of people know what an electrophysiologist is until they come and see you, do they?
No, they really don't, and that's the same question my parents asked me when I wanted to do electrophysiology. After
And what are you doing? You're a cardiologist already.
Yes,
Why would you do that?
Like, what are you going to do? So electrophysiology is a relatively new aspect of cardiology. It's been around since at least 1993, was the very first board certification that was offered for cardiac electrophysiology. I finished my training in '91. It is a study of the electrical system of the heart. I am also a cardiologist. You have to be a cardiologist before you can be an electrophysiologist, and it's a study of why people have arrhythmias, what is the mechanism of the arrhythmias, mapping the arrhythmia to figure out where it's coming from, seeing how they might respond to medication, seeing how they might respond to an ablation, which is actually killing the abnormal tissue, to help treat that arrhythmia so it can not continue to bother the patient, because medicines a lot of times have many side effects. We started out treating arrhythmias back in the 70s and 80s and with cardiovascular surgeons who specialized in electrical surgery of the heart, treating arrhythmias from the bottom chamber, something called ventricular tachycardia, treating arrhythmias from the top chamber, something called supraventricular tachycardia. But like everything in cardiology, seems like we've kind of taken that procedure that the surgeons have done, and we've been able to, with catheters, we've been able to treat these arrhythmias in the electrophysiology laboratory.
And we have to wind it up there, but just to point out, you do this with catheters, so it's not an open heart procedure.
It's not an open heart procedure.
And people can go home the same day.
People can go home the same day.
And again, with something we could talk about for a long time. Unfortunately, that's all we have time for right now. Please share your questions and comments with us at healthtalk@nuvancehealth.org. Thank you for watching. Stay well. And again, if you're feeling any abnormal heartbeats, see your doctor. It's important.